For introduction, first we need to know the definition of archive. Archives are locations where individuals may acquire first-hand information, data, and evidence from letters, reports, notes, memoranda, and other original sources. Our chosen medical archive is the archive of the Rotunda Hospital located at Dublin. The Rotunda Hospital is a maternity facility. It was founded in 1745 by Bartholomew Moses. It is also the world's oldest continually maternity hospital. In this video presentation, we will explain clearly about the archive of the Rotunda Hospital in aspect of activities and the SWOT analysis, which are referred to the strengths, weaknesses, opportunity, and threat.
Now we talk about the list of activities that have been done. First of all is acquisition. The process of admitting content into collection is known as acquisition in archive. The acquisition of patient record at the Rotunda Hospital will not be handed to other unless specific conditions are met, although the procedure will most certainly take a long time. The second activity is collection. A collection of historical material related to an individual, family, or organization in a manuscript repository. Hospital, medical, and health services rely heavily on record collection. It is the heart of the medical service, where all the patient care paperwork is documented and stored for a certain length of time. The collection of patient record at the Rotunda Hospital is very confidential, and others are not permitted to access it. Next is appraisal. Appraisal is the process of evaluating record to decide their eventual disposition, either temporary or permanent. Assessment of patient record at Rotunda Hospital will be preserved in part and deleted in part. The idea of Rotunda Hospital erasing patient information has already been investigated. This is demonstrated by Rotunda Hospital, which is a maternity hospital and a teaching center connected with the Trinity College Dublin. Is known for providing uninterrupted services to women and newborns since its establishment, making it the world's longest continually running maternity hospital. Disposal activity also have been done by this hospital Rotunda in Dublin. Disposal is defined as the physical destruction or transfer of a document to the archive at the end of its retention period. Destroyed electronic record is used to dispose of patient records. More than simply paper records are used by medical workers to maintain track of patient information. Total data destruction by media and electronic shredding is the most effective method of ensuring total data protection. Because the digital world is already at our fingertips, it is probably that this well-known Rotunda Hospital will keep patient information in this manner. It is not as simple as we believe to dispose of all the documents. All areas of the hospital, including the Hospital Rotunda, will be inspected. The disposal is done in accordance with the medical records of disposal schedule and the National Archive Department policy. Thank you.
Now I will explain accessioning. Accessioning is a process of controlling records received in archival or record custody. As for the health records at the Rotunda Hospital, it is based on the policy set by the Health Service Executive. The first form of control is legal control. Legal control is a situation where both parties agree to perform the transfer of the records. Both of organizations should have known the content of the agreement so that they can follow the right orders. Next, physical control, which transportation of health records has two sections, where the first section of the record need to be transferred among health organizations and the second section transfer the health records to an agreed place outside the location. For intellectual control, each medical record has a purpose for what it should be kept and transferred to another place. Staff should not disclose the information to unrelated people. The hospital also needs to maintain a category of medical records such as maternity, mental health, and serious illness. Arrangement and description. Arrangement means a process in arranging archival material according to series, item, and groups to provide understanding to user. Firstly, the arrangement of medical records must be done by the hospital so that the records are not lost. Creating temporary medical records is a way for the hospital to maintain those records. Further, medical records in Rotunda Hospital are likely to have archival value. The purpose of the research conducted was to find archival value and in turn could consider sending them to the National Archive in Ireland. Last but not least, the filling of the patient health records by the hospital staff needs to be done carefully so that the patient information is filled incorrectly. If there is information that is not filled incorrectly, it will complicate the process of locating its storage. Lastly, a description of a record is very important because it is a guide for certain parties such as archivists, organizations, and governments. Level of description is group, series, file, and item. Preservation and storage. Preservation of medical records is very important for the medical sector as it covers all personal data and treatment of patients. The preservation method is to maintain our records for a specific purpose. All pregnancy-related medical information as well as baby information will also be stored in the maternity and newborn clinical management system on ELF Service Executive. Information stored include name, address, date of birth, telephone number, and information from close relatives. The storage period is based on the patient health level category. The record keeping for maternity in this hospital is 25 years after the birth of the last child, while the health record for adults is 8 years after last treatment or death, and for mental problems, the record keeping is 20 years after the last treatment or 8 years after death.
I will talk about the access and reference service. If we talk about the access and reference service, it is not denied that every organization or company had their access and reference service. As for the Rotunda Hospital in Dublin, it had their access. As for its access, if we go to the Medicine Information Service that was provided by the Pharmacy Department, it shows that the service is ready access to give more advice in the management of medication that relate to any queries. It is also open to all the staff out there. Besides that, what that best to the clinical pharmacy staff provided key information about the medication to medical. At the Rotunda Hospital in Dublin, it also had their reference service in way to do any of the surgery. It is important to the hospital because it can be the reference in any hospital that want to do the surgery or anything that relate to the function of the hospital. The Rotunda Hospital, as both a maternity hospital and also as a training center that had been affiliated with Trinity College Dublin, is notable for having provided continuous service to mothers and babies since inception, making it the oldest continuously operating maternity hospital in the world. It is estimated that over 30,000 babies have been born there. Rotunda Hospital in Dublin had their reference service with the Royal College of Surgeons in Ireland, RCSI. RCSI is a medical professional and educational institution which is also known as RCSI University. One of the outreach activities is BIAS, B-I-A-S. Gender Inequality in Healthcare and Research. BIAS is the science week event that was supported and developed by RCSI or Rotunda Research Department and the HRB Mothers and Baby Clinical Trials Network. BIAS aims to challenge public perception about women's health and engage our audience on a variety of topics such as historical perspective on women's health, accepting gender bias in medicine and research, and women's medical issues, including endometriosis, contraception, and mental health. Besides there is the Breakfast Club, that is the story of diabetes in pregnancy in Ireland. In a weekly serialized online graphic novelette, you will follow the life of real women who have gone through the pregnancy journey with diabetes. They will share their experiences, From doing the glucose tolerance test to meeting other women in the breakfast club to figuring out how to use a glucometer to trial and tribulation with diet and exercise to taking part in a research study. Okay, next slide is the SWOT analysis. In all other organization or company that have to have the SWOT analysis. SWOT describe the history of strength, weaknesses, opportunities, and threats. The research-based application and its own strengths and weaknesses. The 6-step process for conducting SWOT analysis is then described, followed by a discussion of factors critical for successful implementation. SWOTs are often arranged in a 2x2 table or matrix with internal enhancers of performance categorized as strengths and internal inhibitors as weaknesses.
Strength is Rotunda Archive has a good record in terms of health and safety of medication for children and adults. They take good care of all medicine for their patients. Second strength is that Rotunda has a good records in terms of quality and safety patient. For example, Rotunda has ensured that their wards and all part of hospital are always clean every year, and that needs to emphasize on behalf of their organization. Next is the Rotunda having a well-organized electronic record service for all mothers and babies. Rotunda is the first Dublin maternity hospital to introduce the full electronic records for all newborn and women receive maternity service of this hospital. Next, Rotunda has good service in terms of the midwifery archive community, acting as a leader for the safety quality of medicine improvement initiative. Last but not least, Rotunda Archive are good in record of employers and staff that who are high community on perform their duties. They have implements the project of electronic patient records that first weakness that occur in the Rotunda is complicated about the problems with gynecology service. That service will be restored, but will take a few weeks to reboot the technology network. The cyber attack is easy to happen, and that's effect to use electronic patient records. Next, Rotunda have a records of birth deaths in the past few years. The plan show the worst performance, and there are some bad records of deaths occur in the Rotunda hospital. Next is opportunity. First, HCI or Healthcare Inform has fully support Archive Rotunda with the development of the train scan system, the staff training and reporting system. Next, Rotunda has a high performance in terms of health service record. This also provides a good opportunity to patients for use this service. Last but not least, Rotunda has a broad archive of important histories. In few years ago, institution moved to different location and become the new lying-in hospital. After that, it was complex, known today as Rotunda Hospital.
The last one is we also talking about the threat, which is to security matter. Medical records are valuable to some people as all Dublin hospitals have too many types of a patient that include rich people. By the hackers will see the opportunity to hide into the hospital system because by data integrity breach can be devastating. Thus, cyber attack or ransomware were a threat in all hospitals. This is because, as I mentioned before, the archive has implemented a way to store records. This will become a threat to the Royal Dublin Archive. The other of threat in hospital is policy and legislation change the result in the budget deficit. Policies are needed because they set a general plan of action used to guide desired outcomes and is a fundamental guideline to help make decisions. The purpose of healthcare policy and procedure is to communicate to employees and desired outcome of the organization. A budget deficit occurs when expenses excess revenue and indicate the financial health of a country. The government generally use the term budget deficit when referring to spending rather the business or individuals. Accrued deficit from national debt. This is due to the budget deficit, which can be seen as an effective fiscal policy. Thus, with the lawmakers automatically causing the deficit to increase and the slowing economy will start to slow down.
As the conclusion, we believe that the Rotunda Hospital is a great maternity hospital that always provided good services for mothers and babies. And the same goes for its archive administration. We believe that the archives of the Rotunda Hospital possess a unique healthcare records and managed by an expert staff and also assist by clever system and first-class facilities. We believe that the Rotunda Hospital archives apply the two crucial principles when managing their collection, which are provenance and original order. Last but not least, a good medical records are very essential for the continuous care of the patients.